Peace be to all. Assalamu alaikum. Omar Abdul-Malik here, physician associate and a health educator. I want to talk to you, those of you all who are applying to various professional healthcare programs, whether that's nursing, nurse practitioner, physician associate, or medical school, or even other programs like physical therapy and occupational therapy. What I think needs to be done is more emphasis placed on maintaining ethical standards and high moral standards among healthcare providers. Patients are concerned and scared enough about their health that they're willing to strip naked in front of you and let you examine them and poke your instruments and gloved fingers in their various orifices. As sordid as that may sound, that's a huge trust. It's an amana. So we who are healthcare providers have got to be people of very high moral standards. Our patients have got to be able to trust us. They have to trust that we won't breach their confidentiality. When I was working in HIV medicine, there were patients whose families didn't even know that they had HIV, and closest friends didn't know. They had to trust that when I saw them, I would keep their information totally confidential and not tell anybody. And I've had people try to squeeze information about patients out of me. To no avail, I'm proud to say. So people have got to know that they can trust you. This starts with your character. One of the things that I look at when I was on various admissions committees for different programs was, what was the person's character like? What did it seem to be like? Were they able to answer various ethical case studies that were thrown at them in a manner that I thought was acceptable? Of course, you never know until you're in a particular position. I've unfortunately been in the position of having to let family members know that their loved one didn't make it, or they died. Whether that's running a code that ended with the unsuccessful resuscitation of the patient, or a young person, especially in the area where I work, a young person coming in and dying of multiple gunshot wounds or drug overdoses. It's not an easy thing to deal with. And you never know how the family or the friends are going to take this information. Sometimes you may be on the receiving end of their emotional outburst. That may even be in a way of physical or a verbal assault. So you've got to be the one that keeps a cool head. And that comes with a lot of maturity. So I look for maturity in potential healthcare providers. The students who I mentor. I'm going to go over some books that deal with medical ethics in the future, Lord willing, inshallah. But this is a very important thing. It can't really be quantified. In a lot of the videos that I view is always this talk about your MCAT scores or your GRE scores, or your passing your pants if you're a physician assistant, or your USMLE. What kind of scores you have to get. But these are things that you're able to quantify, how maybe how smart a person is, or how well they take exams. But it doesn't necessarily give you an idea of what this person is like as a human being, or their ethical standards. How many doctors and nurses, and even people in my own professions, PAs, have breached patients' confidentialities. They've done terrible things to people, and some of them are in prison to this day as I speak. So that's the thing that I think needs to be emphasized in greater depth in schools. So I've been in the healthcare field for over 30 years now. I got my start as a nursing assistant, taking care of elderly people, our beautiful senior citizens. This was back in 1990, and all the way to this day as a physician associate, since 2000. It's been a real privilege and an honor for people to divulge some of their deepest, darkest secrets to me, and I will take some of those things to the grave with me, unless they give me permission to divulge it to somebody. But I take the trust that they've given me, very seriously, and I hope that you all who are considering a medical career or a career in health and the health sciences, I hope that you keep that in mind also. That's it for now. If you want to be a physician assistant or a health educator like me, those are two things that I know a little something about, as the young people on the street say, if they're still saying that. But I'd be happy to mentor you or even give you some advice or tell you about some of my adventures. You can reach me by email, and I'm proud to say that I've helped some people become doctors and physician associates, and they're doing quite well now. That's it for now. Wish you guys the best of success in your positive endeavors. Take care. Peace.